Ms. Amanda Cardwell Carones, who will be refreshing the global perspective through her talk Ophthalpreneurs. It's an intersection of the entrepreneurship and ophthalmology you don't want to miss. Over to Ms. Amanda.
So I appreciate the opportunity to be here, and I want to share with you a little bit about Ophthalpreneurs. But before getting started, I would like for you to imagine this. Imagine that you're a brilliant MBA graduate. You have spent years immersed in learning business strategy, finance modeling, marketing, leadership. You can balance a P&L in your sleep. You know how to negotiate deals, and you know how to grow a brand. But now imagine that you walk into your new job as the CEO of an ophthalmology practice. And the first thing you're told is, here's your patient. Today you're going to perform cataract surgery. This would probably be your reaction, right? No medical training, no internship, just your intuition and maybe a few YouTube videos at best. This sounds absolutely absurd. But this is exactly what happens in reverse to ophthalmic surgeons who open or run private practices. After you've spent years mastering medicine and pathology, optics, microsurgery, you're suddenly expected to understand P&Ls, how to hire and manage staff, how to design a marketing strategy, how to negotiate with suppliers, navigate patient acquisition and patient education, without ever being trained in any of this, not in med school and not at most major scientific congresses. So that's the gap between medicine and business that we're trying to solve with Ophthalpreneurs. Because thriving in a private practice today requires more than clinical excellence. It demands business acumen, and it's time that we stop pretending that doctors should just figure it out alone. You know, if we look at what's happened over the past 50 years, there's been tremendous advancement when it comes to lens surgery. I'll just use lens as an example. We've seen technological advancements, many new treatment options available, and with this comes changing patient expectations. And then when we look at the private healthcare spending in India, we see that what's expected to happen over the next 9 years is a 67% increase in the amount of money being spent. So things are not slowing down at all. What are the factors growing healthcare in India? Medical tourism is expected to increase by 25%. The use of advanced medical technologies and a significant growth in private health insurance programs. And if we look at lens surgery, you know, historically speaking, we were primarily focused on the older age group, the patients who had medically necessary cataracts. We were focusing on pathology, giving them basic vision restoration, and you know, in years past, it was a lengthy recovery period. And when a patient would choose to go privately, it was primarily to choose the doctor and to choose the date. But today, the patients that we're targeting for lens surgery may or may not have a cataract. We've expanded this age group significantly, really, you know, as far back as 2 generations from what we were originally targeting. Today, it's a performance-driven approach where patients are looking for a better lifestyle, they're looking for customized solutions, a premium patient experience, and their motivation for going into private is really more value for their money in addition to the convenience that they may be looking for. What this requires is a mindset shift from vision performance versus just pathology alone. It means we have to start thinking in terms of participatory medicine, where the patient plays an active role throughout their care, where we're personalizing the approaches to the individual patient and improving customer service, which means that we have to think differently from what we've done in the past. I wanted to share, I think this is a very powerful publication that came out a couple of years ago by the Harvard Business Review. What they did is they surveyed 362 companies, CEOs, and they surveyed as well customers of those companies. And what they asked is, how do you rate the level of customer experience that your company provides? When they asked this question, the CEOs said 80% of their, or 80% of the CEOs said that their companies provided excellent customer service. However, when they asked the customers of those same companies how well the customer service was delivered, only 8% of the customers said that the service was excellent. And what this means is that there's a huge gap between what we perceive as a practice and what our patients or our customers may perceive. There's always another perspective. Some of the things that have to be considered when we're looking at private practice today are patient management strategies. This is an example from my husband's practice here in Milan. You know, in 2011, this is what the patient flow looked like, where he was spending 45 minutes with each individual patient. We basically ran into a situation where we could not accommodate more patients during the day, so we had to look for alternative methods. And this is what our patient flow looks like today, where the patient spends 60 to 90 minutes with an orthoptist prior to seeing the surgeon for 10 minutes for the visit. We've had to look at changing our communication strategies. In the past, it was primarily through word of mouth. But today, we have to look at multi-channel options. We're looking at social media, we're looking at websites, we're looking at Google reviews. Those were things that we didn't have to consider even 10 years ago. We look at leadership and business acumen skills. Today, we need to know as private practice employees how to manage our staff. Who needs to make up that staff? How do we recruit and retain employees? And how do we continue to develop them? Because having an exceptional team is critical in a private practice today. We have to learn things like financial management, leadership development, how to build strategic partnerships, and how to constantly innovate within the practice to stay ahead of the game. So there's a new reality that we have to embrace to stay ahead with the evolving needs. We have to think about performance-driven care and how to enhance the patient experience. And the problem is, no one is teaching these skills until now. That's why we created Ophthalpreneurs. And a lot of people ask, what is it? Is it a congress? Is it a society? It doesn't really fall into any of these categories. I would say it's a movement. And it's our movement as people who work within the private ophthalmology sector. We're trying to bring all of the stakeholders, whether you're a surgeon, whether you are working for industry, whether you're an allied health professional, we're looking to bring all of those stakeholders together so that we can drive change and catalyze the future. We're trying to give doctors skill sets that they didn't have in the past in order to be successful. So until today, we started to just share with you very briefly how Ophthalpreneurs came about. It started out with an idea to do a 3-hour instructional course at ESCRS only on the soft skills associated with implanting presbyopia correcting IOLs. And this 3-hour course was not accepted, and we decided that if we wanted to try to teach these types of skills, we probably needed to do it separate from any of the major congresses. So that's what it started out to be. And then as we talked to surgeons just like you, ideas came about, we should add a little bit of finance. We need to add something about HR. We need to understand how to train our staff. So it became a much bigger initiative. And to date, these are the meetings that have taken place. Our first big meeting was in Stresa, Italy last year in March. And we just had another 3-day meeting in April in Taormina in Sicily. But as you can see, we're involved with ACOS, we're involved with BRASCRAS, with the European Vitreoretinal Society. So we've had some opportunities to present at other meetings as well. One thing that really sets Ophthalpreneurs apart is we are not just seeking sponsorship. We want true partnerships with the industry that we're working with. So we take their suggestions very much to heart. We're trying to bridge the industry as a whole so that companies like Hoya, Alcon, J&J, Zeiss, these companies are all working together in order for us to have one collective voice so that we can drive the market and drive change. So that comes with the online community and the in-person events. We're getting ready to launch something called Ops Master Visionary Program, Ophthalpreneurs MVP. This will be an online program, especially for younger or newer private practice surgeons, to give them the skill sets that they need to get started and be successful right out of the gate, especially if they don't have the time or the financial resources to attend an MBA program, uh, you know, as they're starting out their career. And then lastly, we're looking to begin creating some public awareness initiatives that would be deployed via social media. So this is, if you're interested in joining the community, we do have an app with the ability to communicate with other people within the community. This is the QR code to go to the registration page for the app. And we would love to have you join us. The more we can begin sharing, the faster we can improve our jobs and make our jobs easier. So I appreciate Hoya and Sri Ganesh for the opportunity to present Ophthalpreneurs to you, and would like to say thank you for having me here.